For 100 years, our mission has been to provide high-quality, patient-centered care and care close to home. And that is a commitment that's timeless.
It's great to be part of a hospital that's been here for 100 years.
Munson Healthcare Charlevoix Hospital has a rich history tied to a little city with roots in logging, fishing, farming, and tourism due to beautiful shorelines along inland lakes and Lake Michigan. Among the early pioneering physicians, two were key in establishing a place for hometown care in the community. The first, Robert Bruce Armstrong, M.D., proved a man for his time. He arrived in Charlevoix following graduation from the University of Michigan's Medical School in 1894. When the hospital opened in 1920, he became its first administrator. Meanwhile, F.F. McMillan, M.D., arrived in Charlevoix in 1919 from Indian River. Along with Dr. Armstrong, he cared for many of the residents in the city and beyond.
Dr. McMillan came to see us all. He was very kind. We were a family of 5 kids. We all had a bout with scarlet fever back then, usually one after the other. My name is Esther Carey, and I started working at the hospital, the old hospital, in 1944.
Both Doctors Armstrong and McMillan understood and endured the rigors of pioneer medicine.
Dr. Armstrong's flight to Beaver Island is an interesting story. He had to fly to Beaver Island because there was a young man there who was injured in a logging accident, and Dr. Armstrong agreed to go out there and assist him if a plane could be brought to Charlevoix. So Selfridge Airfield was contacted, and the Army Air Corps went against their normal policy to send a plane. In inclement weather with blowing wind and bad snow, they made the trip over to Beaver Island, where they landed on the inland lake there. And this was the very first time a plane had flown to Beaver Island.
Meanwhile, Dr. McMillan's enduring efforts at care can be summed up in a story that involved a trip to Norwood on a cold, snow-blown night to deliver a baby. He was in a sleigh with a young Julius Elzinga of East Jordan as his driver. The sleigh overturned and the doctor's shoulder was dislocated, and the contents of his medical bag scattered across a snowdrift. The story goes that young Julius popped the shoulder back in place after instruction from the doctor. Dr. McMillan then went to the farmhouse to deliver the baby using one arm. Both physicians were advocates for a new hospital, but both never lived to see it. Dr. Armstrong died in 1940, while Dr. McMillan died in 1948. However, their young colleague, Dr. Gilbert Saltonstall, took up the cause. The University of Michigan Medical School graduate grew up in Charlevoix and returned in 1934 to practice medicine. He brought with him the latest medical knowledge and skill. He performed the hospital's first blood transfusion. There also is the story of his overnight train trip to a military facility downstate during World War II to obtain penicillin for a patient with a severe postpartum infection. He obtained the drug, returned on the next train, and saved his patient.
I don't know what strings he pulled, but he needed it and he got it.
In 1948, 1,011 patients were admitted to the hospital. There were 229 births and 779 operations. The board started discussing the potential for a new hospital. By 1949, the need for a new hospital building became urgent. The state fire marshal told the board extensive changes would be required for the old wood-framed building on Hurlbut Street. The city sold the hospital board its trailer and camping park acreage on the lakeshore for $1. A community fundraising campaign commenced, and by the end of 1951, $294,000 was raised to match a $275,000 grant from the federal government. On August 26, 1954, the new 44-bed hospital building was dedicated. Later that decade, in 1957, the solarium was added, and in November of 1958, a tragedy on Lake Michigan would put the community hospital on the national stage.
When the Carl D. Bradley went down, crew was all lost except 2 people.
The 639-foot freighter was headed to Rogers City to pick up a final load of limestone for the year. It broke apart in a fierce storm and sank quickly southeast of Gull Island in Lake Michigan. 33 of the 35-member crew were lost.
The 2 survivors were in the water for 14 hours before they were found. 65-mile-per-hour winds, waves up to 25 feet high.
It was an anxious time until they brought them in, of course.
The staff there acted very professionally and did a great job.
The boat was owned by U.S. Steel. They made and gave stainless steel bracelets to all employees.
The presence of Charlevoix Hospital may never have been more appreciated than on a July night in 1997 when fireworks exploded into the Venetian festival crowd. The local newspaper extolled the efforts of doctors, nurses, and volunteers to treat the injured. Throughout the emergency, cooperation and compassion conquered fear, whether downtown or at the hospital.
You do feel like you're a part of something bigger than yourself, even though it's such a small place. It's important to this town, and I think the people here really value knowing they can have local health care.
Over the years, hospital leaders, in collaboration with physicians, staff, and a generous community, have worked hard to ensure the right services are in place to meet needs. State-of-the-art radiology services, a beautiful birthing center, infusion services, and local access to Munson Healthcare specialists are part of the latest chapter in its ongoing mission.
So while we're a part of the healthcare system, being a community hospital, what we bring to the table is we know one another, and our communities that we serve know us as well. So it's really a very close-knit, families taking care of families, neighbors taking care of neighbors.
I loved Charlevoix Hospital. Loved working there.
I can't go anywhere, really without someone either coming up to me and saying, hey, look at little Johnny. And it's fun for me, but it's also fun for my family because it happens everywhere we go.
Charlevoix Hospital is proud to have been here for 100 years serving our communities, and we're looking forward to the next 100 years.
100 years of caring through the challenges and storms of life creates memories and bonds that pass through generations and instills confidence for a bright future. Like a beacon on the shore, Charlevoix Hospital's light keeps shining.